Did you know that coffee can cause insomnia, anxiety, and headaches?
I switched one of my cups of
Hello there, everyone. Welcome back to 3 News Now. I'm Stephanie.
moments after we grant recording permissions.
There you go.
All right, I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, thank you very much. I appreciate everyone joining us here today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Well, on my walk last evening, I saw more signs that spring is upon us here in Ohio. And I'm happy to report that even as you may be seeing more green outside your window these days, we're also seeing more green in another important area. On the Centers for Disease Control and Prevention's COVID-19 community level map of Ohio. Their latest map shows that 80 of Ohio's 88 counties are green, indicating the lowest level of concern. 8 are yellow for medium, and significantly, no counties are now orange or high. This is a significant improvement from 2 weeks ago when 10 Ohio counties were orange. The COVID-19 community level, as you combines 3 measurements: case rates per 100,000 residents, along with new COVID-19 hospital admissions and the percent of inpatient hospital beds occupied by COVID-19 patients. Now, like the rest of the nation, Ohio appears to have put the most recent surge behind us. New cases and hospitalizations are at their lowest levels since last July or August. But as we have seen the pandemic, COVID-19 has a real habit of throwing us curveballs. And so, even as we breathe a little bit easier here in Ohio and across the United States, we also need to keep a close eye on events around the world. Our experience with previous surges has shown us that what's happening in Europe or in other highly developed nations has often been instructive and offered us insights and lessons for right here in the United States. Now, in much of Europe, the Omicron wave actually hit them after it hit much of the United States, including Ohio. Fortunately, some in Europe, including the Netherlands and Denmark, appear to have passed their Omicron, and they're now declining. But while our Omicron surge was primarily driven by a subvariant known as BA1, theirs has been largely driven by a later subvariant known as BA2. But whether we talk about BA1 or BA2, we're talking about Omicron. What we've learned from our European counterparts, especially in the Netherlands, is that while BA1 are closely related, BA2 seems to have an edge on its cousin BA1 in terms of being more contagious. Nevertheless, they seem to have similar severity, be similarly responsive to vaccines, and very importantly, it's rare to see a BA2 infection after a BA1 infection, which means immunity to BA1 provides good protection against BA2. So, what's the dynamic of BA1 and BA2 here in the United States, which, unlike much of Europe, endured a massive wave of BA1 before the arrival of BA2? The CDC tells us that across the country, as BA1 is fading, BA2 is assuming a growing percentage of the declining of Omicron cases. To use a baseball analogy, BA2 is playing cleanup, but probably won't hit a home run. In Ohio, we haven't yet seen much of BA2. Our most recent fairly complete genomic data from clinical cases dates from January 7th to March 8th and shows that only about 2% of Omicron variants were in fact BA2. Likewise, looking at results from our robust wastewater testing program, BA2 has been found in only a few of the 74 watersheds where we collect samples. Having said that, preliminary data from the last few days do indeed suggest that BA2 percentages could well increase in the coming weeks and months, just as we're seeing across the rest of the country. Nevertheless, it's important to understand that because BA1 and BA2 are so closely related, there's good reason to believe that we will not face another BA2 surge like the one we had with BA1. Again, to use our baseball analogy, even if BA2 were to hit a home run, BA1 has before BA2 even came up to bat. Now, whether it's BA1 or BA2, vaccines remain our best bet for safely shielding ourselves from severe disease. According to a CDC report released Friday, during this most recent surge, adults who were fully vaccinated and boosted, meaning they had had 3 doses of an mRNA vaccine, whether Pfizer or Moderna, they were 94% less likely to be put on a ventilator or to die of COVID-19 than those who were unvaccinated. To put it another way, the CDC reported that among people ages 12 and older, those who contracted COVID-19 in January and were unvaccinated were 21 times more likely to die than those who were fully vaccinated. Those are startling numbers, and they serve to underscore both the efficacy of vaccines and the urgency of making sure you're getting vaccinated and keeping up with your boosters. Now, I've mentioned before that the mRNA vaccines, and particularly the recommended 3rd dose or booster dose, appear to prime the B and T cells in our immune system that help provide us with more long-lasting protection against severe illness. These cells aren't great at keeping us from getting infected, but they're very good at keeping us from getting severely ill. As we look at all these reports then, what really emerges is that our vaccines have illustrated and reinforced just how important immunity is in helping us weather infection, and that the best and safest way to assure our immune systems are well prepared is to be vaccinated. Now, in Ohio, 66% of those who are eligible for vaccines have started their vaccine series, and 61% have had 2 doses. But that means about 1 out of 3 eligible Ohioans remain without the benefits of vaccination, and millions of others, especially those who are of more mature years, are missing out on the further benefits of a booster. So there's more work to be done to get the facts out about vaccination so we can help more people weather whatever COVID-19 storm awaits us over the horizon. Joining us now to discuss some of the efforts happening right here in Ohio at the community is Chris Cook, the Assistant Health Commissioner for the Clark County Combined Health District. Chris, at this stage, 2 years after the onset of the pandemic, how are you prioritizing your vaccine outreach?
Well, Dr. Vanderhoff, first, we are recognizing that the purpose of vaccination is different now. When we first got that vaccine, our goals have changed. In the face of the original COVID-19 virus, the Alpha variant, and then also with the Delta variant, the vaccine was very effective at not only keeping people out of the hospital, but also preventing infection. The current purpose of vaccination in the face of Omicron, whether it's BA1 or BA2, is to prevent severe illness, hospitalizations, and deaths. It's also to protect those immunocompromised in our communities, and of course, those who can't get vaccinated, those being under age 5. We still firmly believe that we can positively impact our communities with vaccine. We can lessen the burden of COVID-19 on both individuals and our healthcare system as a whole. And we're coming out of an unprecedented surge, and it wasn't our first surge and likely won't be our last. It's not the time to leave things to chance. In public health, we don't really leave things to chance. We're very intentional. And that goes for more than just COVID-19 vaccines. That's why we do things like inspect restaurants. We don't leave your ability to get a safe sandwich to chance. We work to prevent sickness before it happens. So we continue to vaccinate because we still have an opportunity to decrease the number of people getting sick, decrease the number of people being hospitalized, and of course, decrease the number of families who might have to endure the suffering of losing a loved one from COVID-19. So here in Clark County, our team continues to critically examine the data and bring more resources into those areas of our community with, number one, higher than average case rates, number two, high hospitalization rates, and then number three, those lower vaccination rates. That's our focus right now, and that's the data that we're following here to make an impact on our community.
Well, Chris, what are some of the strategies you're using there in your county to reach these vulnerable Ohioans?
Dr. Vanderhoff, a lot of the work that we're doing right now is viewed through the lens of health equity. And I know that term gets tossed around a lot, but health equity means that everyone has a fair and just opportunity to get vaccinated. We can't just say everyone who wants it have the opportunity to get it, because this assumes that we all define opportunity the same way. And we know that's not the case. So as we've followed our data and we've looked for new opportunities to overcome health disparities, we've revisited some of our more familiar places here in the county that we've been to. Local health departments really know their communities, and that's the case here in Clark County. We follow the data, but how we each craft our intervention is a little different. So we use continuous quality improvement processes and do one thing I think is very important in public health is shift quickly as things change and look for those new opportunities. So for example, here in Clark County, we have partnered with a new grocery store in town called Groceryland, and that's located in one of our vulnerable neighborhoods. And we're at Groceryland every week to offer vaccine. And with each passing week, we're gaining the trust and the recognition that this is a place to get your vaccine. We're offering vaccine at our Women, Infants, and Children, or WIC office every single week. We offer some drive-up services there, which can be really easy for our families with lots of kids. And WIC is such a trusted and fantastic resource in our community. And frankly, it's been one of our best clinics over the last month. We've also been to 4 different food pantries in our high-risk neighborhoods, and we've been to a couple of schools as well, and we open that to the entire community. And we're seeing movement in all of these areas.
Thanks, Chris. What about the work with providers in the community? How are you coordinating with them to help get vaccines to people who need them?
Well, we know that half of our residents here in Clark County right now are getting their COVID-19 vaccine from our pharmacies. We talk to all of our pharmacies and let them know what our goals are for achieving certain vaccination rates where those pharmacies are located in these neighborhoods. And they're helping us work towards these goals. You know, pharmacists, much like doctors and health departments, are just another one of those trusted resources in the community that people feel very comfortable with if they want to get their vaccine. In particular, next week here in Clark County, we're partnering with Rocking Horse Community Health Center, that's our federally qualified health center here in Clark County, to host a vaccination event. And that's going to be held on Friday, April 1st, and it's going to be a neighborhood event. We want people to come from the neighborhood who want to get their first dose of vaccine, maybe a second dose, and definitely those who still need to get that booster. We're going to have a healthy breakfast snack or two and some fun activities for kids. So we're really looking forward to this opportunity to serve the community alongside one of our trusted healthcare leaders here. And I think we still have work to do, especially when it comes to boosters, as you've mentioned. As you know, the CDC is producing that data almost every day that's demonstrating how effective these boosters can be and have been in both the Delta and Omicron surges. Vaccines, even specifically boosters, have been proven to dramatically lower the risk of both infection and severe illness. Adults who had boosters during the Omicron surge were 12 times less likely to be hospitalized for COVID-19 as compared to those who weren't vaccinated. But the reality is this: people aren't really thinking about getting a booster because many people had Omicron in the last couple of months and they have some level of immunity. But I think what we're missing is that we don't know how long that infection-acquired immunity will last against Omicron or another variant. Infection-acquired immunity is unpredictable. You mentioned the first day of spring being this week and things you were seeing on your week, this week during your walk, and no one wants to really think about winter right now. I know I've put my snowblower away, right? And I think when I talk to people about boosters, I compare it to snow boots for kids. If you've ever had kids, you know how quickly they outgrow snow boots from year to year. And if you've been in any store or maybe an early garage sale so far this year, you know that snow boots are on clearance right now. There's little demand for them, but you know that your kids are outgrowing what they had. And we're surely going to have another winter here in Ohio. So I'm going to go get my snow boots for my kids now while they're on sale because my kids have outgrown what they have. And I don't want to wait for that first snow to hit again. And I offer that same advice to those who need a booster. Get your booster now. You've maybe outgrown that primary series that you got last year. Don't wait for that snow or that next surge to hit. Get vaccinated for what's next. Boosters continue to be safe and effective. And frankly, they can still be the deciding factor between a mild illness and being on a vent.
Thank you so much, Assistant Commissioner Cook. Well, again, with the goal of boosting vaccination rates in Ohio, two groups of people among whom we see a real opportunity to reach more people with our message about vaccination are among our rural residents and our children. Breaking down the state's vaccination rates, it's clear vaccination rates are higher in our metropolitan areas. In the counties that include our three largest cities, Franklin, Cuyahoga, and Hamilton, between 65 and 68% of residents are fully vaccinated. That contrasts with much of rural Ohio, where county rates are frequently less than 50%. Likewise, our school-aged children are lagging behind in their vaccination rates. Among Ohio's children, ages 12 to 15, the rate is 43%, and among those 5 to 11, it's only 22%. The reason this is concerning is that during the Omicron surge, children were much more likely to contract serious disease than they were during the previous Delta surge. So things had changed with Omicron. The CDC recently reported that in the peak of the Omicron surge, hospitalization rates for children were 4 times as high as they had been during the Delta peak. So, more than a year after vaccines first became widely available, we still have a real window of opportunity to reach many more Ohioans and encourage them to get vaccinated. Now, to talk about these issues is Dr. Kevin Sharrett, Medical Director of Rural Health for Kettering Health. Good morning, Dr. Sharrett. What are some of your thoughts on why vaccination rates are in fact lower among rural Ohioans, and what are you hearing from your patients in this regard?
Good morning, Dr. Vanderhoff, and thanks for having me involved today. You're exactly right in terms of what we're seeing in the rural communities compared to our general population. That vaccination rates certainly are lagging, and we're seeing about a 20% decrease or a difference between the rural and suburban and urban areas, and not only in Ohio but nationwide. I think the CDC statistics bear that out, and I think there's several reasons for it. initially early on, it was just because of the availability. In rural areas, certainly you don't have the same levels of availability that you might have in some of the urban and suburban areas. And early on, certainly with the rollout of the vaccine, we were seeing that, and we worked really hard and continue to work in those areas to make the vaccine available. As time goes, though, the availability of the vaccine is to the point now where we're not seeing that discrepancy between the urban areas and the rural areas in terms of the availability of the vaccine. So clearly, there are other variables involved. And as I look at it, and what I'm seeing on a practical note is I don't think it's any one factor that is leading to it. I think it's a combination of factors. And the thing that's interesting when you look is that there's also discrepancy for vaccination rates when we look at other vaccines. When you look at the shingles vaccine, for example, or the pneumonia vaccine and the flu vaccine, the influenza vaccine, there has always been a discrepancy between the rural communities and the more urban suburban areas. And as I said, I think availability is one. That's certainly one issue that needs to be addressed. And I know that the Ohio Department of Health and our local health departments, as Chris just alluded to, are working really hard to get the vaccine out to where it is available to everyone. But, the people in our rural communities where I live, many of them live a mile off the road. They don't see their neighbors. They have to drive 10 miles to get a loaf of bread and a gallon of milk. And when you live in that kind of a setting, you kind of tend to look at life differently, and people who live in these areas, have a real independent spirit about them, which is a very positive characteristic, but yet it also gives them a different mindset maybe towards illness and towards vaccine. So, the people who live in the rural areas are drawn to the rural areas for a reason, and it does affect, kind of their approach to life. And so all of these things have to be factored in, and certainly the availability of the vaccine is getting better all the time. And we're seeing, more and more people getting vaccinated, but certainly not nearly enough. And there's certainly, as you said, room for improvement and opportunities, if you will. Now, patients are sharing with me some of the same concerns that we're hearing across the board. And I think if you had to break it down to one word, that is the most compelling reason people are not getting vaccinated is because of trust. They simply do not trust our government. Let's face it, they don't trust our government. They don't trust the vaccine. They don't trust the vaccine manufacturers. There really is still a level of distrust out there. And what we have seen is that they come to us. They come to their providers. They come to their primary care physicians. They come to their advanced practice providers. They come to their local health department to get information. And the information that they get helps them form a decision. So the patients that we see, the patients that I see every day, I'm still asked every day about the vaccine. Do you trust it? What do you think? And we're over a year into this now. And what I'm able to share with patients now more than ever is that, yes, I do trust the vaccine. We talk about the technology. We still talk about the mRNA technology. And I share with them that these vaccines raise the bar in terms of vaccination. And these are the best vaccines that I've ever seen in terms of being effective and being safe. And that's just not talk. That's substantiated time and time again. And so we explain to patients that, we're going to face COVID. You are going to face COVID. There's no question about it. And are you better off with the vaccine or without the vaccine? And as you alluded to earlier, the numbers continue. The more we study these vaccines, the more there is for us to be confident in them. And the vaccines clearly make a difference. They clearly are game changers. And so we're urging everyone that we can talk to reconsider if they've decided not to be vaccinated. We've asked them to reconsider it, and we've told them it's not too late. This situation is evolving, and it's perhaps even more important now than ever to be vaccinated. So we address their concerns. We ask them to talk to their friends, talk to their family, share the information we give them, because we realize we have limited exposure, but as the word gets out and they share with what they've learned from us with with the people they come in contact with, hopefully the level of acceptance will improve.
Dr. Sharrett, thank you very much for that. Now, that turns my thoughts in the direction of our children. What about our school-aged children, and what is your message to parents in the office and maybe are feeling a little hesitant about getting their school-aged children vaccinated? What do you share with them about some of the potential benefits, either as they're looking ahead to summer camp or to school next year?
Sure. So, the first thing we share with them is what has already been stated here, is that this virus is ever changing, and that's the second wave, as you said, really had a much more dramatic impact than even the first wave. And we cannot, the only thing we can really predict about this is that there will be changes, and it will evolve, and there will be more variants coming down the road. And so again, we come down to the basic discussion: is your child better going forward and facing this virus and facing the changes in the virus? Are they better being vaccinated versus being unvaccinated? And we talk about simple benefit versus risk. And so the benefit clearly outweighs the risk. Now, parents, first of all, if a parent has not been vaccinated themselves, and if they have strong feelings, then obviously those strong feelings carry over towards their children, rightfully so. If we see a lot of parents who are vaccinated realize the value of the vaccine for themselves, but are hesitant to have their children vaccinated because they say, listen, I just don't know about the long-term effects. I don't know, is this, are we going to find out 5 years from now, 10 years from now, 15 years from now, that there's some sort of really catastrophic problem with this vaccine? And so I share with them, first of all, that if there are problems with vaccines, we know those problems early on. And the fact that we now have over a year's worth of experience with this vaccine, that we would have seen those problems. Secondly, I explained to them that the idea of vaccinating and protecting your children from future illness is obviously not new. These same parents that are struggling some with the COVID vaccine recognize the value of the other vaccines that they have their children vaccinated with. And I explained to them that this vaccine, in my opinion, this is my opinion, and I think the opinion is well substantiated in science, this vaccine is extremely effective and it's extremely safe, not only short-term, but long-term, and perhaps not to diminish the effectiveness or the safety of the other vaccines that we use every day. These vaccines are at least that safe and at least that effective or more. So, if you accept the idea of the value of vaccine and the protection going forward, then this vaccine should be even more accepted than the vaccines that they've become accustomed to for measles, mumps, and other illnesses. But the last thing I tell them is this: as I said, I tell them that you have a choice. You can either face this unvaccinated or face it vaccinated. The consequences long-term from the virus are much more significant than the consequences of the vaccine. And so simply, it always comes back down to the benefit versus the risk. And again, in my opinion, the benefit dramatically outweighs any potential risk.
Thank you very much, Dr. Sharrett. Well, as we wrap up, I want to briefly highlight two tools we have at our disposal to combat whatever may come next in our experience with COVID-19: therapeutic treatments and wastewater monitoring. Since monoclonal antibody treatments first became available in November of 2020, Ohio has developed a robust provider infrastructure that includes local hospitals, infusion centers, long-term care pharmacies, federally qualified health centers, and community pharmacies. And now we also have limited but growing supplies of a highly effective and tolerated pill, Paxlovid, that gives us a potent tool for future waves. Now, while therapeutic supplies remain very limited nationally, we are in many respects at the beginning of the COVID-19 therapeutic era, and therapeutic options for the management of COVID-19 will continue to evolve over the coming months to better enable healthcare providers to intervene therapeutically to help mitigate the impact of future waves of COVID-19. Surveillance is also critical to our ongoing mitigation efforts. The Ohio Department of Health now monitors 74 community wastewater treatment plants geographically spread across the state for coronavirus gene copies twice a week, and we've done that since August of 2020. This has been a very effective early warning system for us. More than 1,000 alerts have been sent to local health districts and utilities since the inception of the program, when significant increases in viral gene copies have been observed. And in December 2021, so just a few months ago, Ohio became original pilot states to upload data to the CDC's National Wastewater Surveillance Program, which is a real credit to the importance of Ohio's system. The wastewater program is one example of our readiness, and we are proud that the Trust for America's Health, a national nonprofit health policy organization, recently rated Ohio in its highest tier of readiness, 2021 Public Health Emergency Preparedness Rankings. That group also cited Ohio as one of 3 states that demonstrated exceptional progress. Now, looking ahead to what's happening worldwide, it's clear COVID-19 is not a thing of the past. COVID-19 is not going away, but is becoming part of the fabric of our lives. It's something we must learn to successfully manage as it ebbs and surges. That means we have to be prepared as a state and as individuals. And now is the best time to prepare for whatever's around the corner. It remains true that among all the weapons we have to combat COVID-19, our immune systems are essential, and vaccines are the way to boost our immune systems and ensure that we're as prepared as possible. Vaccines, quite simply, save lives. Thank you. And now, Ken, I think we can open it up for some media questions.
Okay, thank you, Dr. Vanderhoff. Our first question today comes from Spencer Hickey with Hannah News.
Thank you. Given the comments on youth vaccination and some of the challenges there in general, could you discuss how ODH would handle distribution and promotion of under 5 vaccines if that receives federal approval, as was recently requested by Moderna?
Yeah, I'd be happy to, at a high level, talk about how we're thinking about preparing for a potential advent of vaccinations for the youngest age groups. Of course, all the details remain in the hands of both the FDA Advisory Committee and ACIP, as well as the CDC and other federal agencies in terms of how that vaccine would be distributed. But with that in mind, what we have been doing is carefully following the emerging literature about the safety and efficacy of the vaccine from the trial information. Now, a lot of that is still not widely available, still being reviewed by scientists. But nevertheless, we keep a close eye on that, and we continue to develop appropriate messaging related to the information, particularly the information once we have final guidance that would come to us from the Advisory Committee on Immunization Practices. So our stance is, much as it has been for preparing for the potential arrival for other age groups. But unfortunately, we really can't take firm and definitive steps until we have the guidance and until we have clear indications, not only regarding how it is going to be delivered to us, but also for whom it will be appropriate. So preparations are in the background, but there's a lot that's still unknown.
Our next question comes from Joe Ingles, Ohio Public Radio and Television.
Good morning.
Good morning. Thanks for having us. I wanted to ask a question. A lot of people, it seems like it's going back business as usual, and everyone is going back to their offices, back to their regular routines in crowds, and that's being encouraged at some point by the CDC. But what is also happening is people are not paying attention to this at all. I mean, they've kind of just wiped it out of the back of their mind. What advice would you have for employers and people who are businesses, people who are trying to make their place safe for people and for everyone who's getting this, hey, it's business as usual attitude?
Well, thanks for that question. There's no question that we do have to live with virus is now part of our fabric. And therefore, we have to be able to live our lives with it as a part of that fabric. But as I've shared here this morning, this lull in viral activity, this quiet time, is not a time for us to ignore the virus. Rather, it's really a time to prepare. This is the best time, as both Assistant Commissioner Cook and Dr. Sharrett communicated, I think, so well, for all of us to look at what we can do to put ourselves in the best position to deal with COVID-19, however it returns into our communities. And clearly, looking at our opportunity to get vaccinated or potentially boosted is one of those key steps that we can all undertake. I think another is in our workplaces, in our places of worship, in the places that we gather, the places we go for leisure. We can look at those environments and say, hey, what can we do to make these environments even safer? What about ventilation? We've learned so much with this respiratory virus about the importance of having good ventilation in the places that we occupy indoors. This is a great opportunity when there is not a lot of spread of COVID-19 to look at what we can do to enhance ventilation and the safety of the air that we breathe. What about getting prepared with masks that are maybe a step up from the masks that we've used previously? One thing that Omicron has shown us is it really is so much more contagious that to prevent spread from one person to another, we really have to be more mindful, especially for those who may be more vulnerable among us due to impaired immunity, about wearing better masks. And this is a good time to look at maybe getting those on hand and being ready. And then there's getting ready with testing. Government is making available free COVID-19 tests for people to order. And what I've heard is that through the first wave, a lot of people signed up and got those ordered, but there's another wave available. And people could be signing up and getting those into their hands, again, as way of preparation. Let me turn to my guests and just see what their thoughts are along this line. Assistant Commissioner Cook, would you want to kick us off?
Sure, Dr. Vanderhoff, I think you just hit everything square on and how I would answer it from a local health department perspective. And I think about what's relevant this week. So yesterday we had some severe weather roll through parts of Ohio, and it was our national or our statewide day for testing some of our emergency systems, including our tornado warning systems. And I think the comparison is right there. It's just been teed up for us. Now is the time to prepare. Now is the time that we can start thinking about what a next wave might look like. don't wait to make that plan for your family. In severe weather when it hits, get a weather radio now, have a plan, I think about in the wintertime, I hate to bring winter up again, but when we think about winter, when snowstorms are pending, right? Everyone gets hungry for milk and bread for some reason. Everyone wants to make French toast, I guess. But when you think about that, let's prepare ahead of time. Let's be prepared for those everyday emergencies. The same thing can apply to this. And as much as I hate to say, I don't think we've seen the last of COVID-19 surges. I think we need to face the reality that we can prepare by boosting ourselves now with vaccine. If you have someone that's high risk, checking in on them, making sure that they've gotten a booster, maybe you can provide transportation to a clinic where they can get that booster now. And then, of course, being very cognizant and aware of symptoms and testing is all really good advice.
Dr. Sharrett, anything to add?
Not really. You guys really covered it extremely well. I guess the old adage just still rings true. An ounce of prevention is always worth a pound of cure.
Thank you.
Our next question comes from Pete Grieve with Spectrum News.
Good morning. With the pace of vaccinations lower nationally and also, I believe, in Ohio, I'm wondering, does that create challenges at all for continuing to make the vaccine accessible at, the wide variety of locations that the state wants to, especially when we, providers also want to be good stewards of the vaccine and not waste doses?
Yeah, thank you. That's a very, very good question. And what I would say is that what we are having to do now in terms of vaccine delivery is we face a different challenge than we faced perhaps very early on when vaccines arrived. Then the challenge was we had very, very high demand. And how do we meet that very, very high demand? It was more of a logistics delivery challenge. Now we're faced with a challenge of identifying and understanding our opportunities to lower the threshold of difficulty for people to get vaccines. And both my guests, I think, pointed to this in their comments. What can we do to just make it so much easier for people to get vaccinated, make it highly accessible? And so we're looking at a variety of factors. And first of all, identifying how can we get information to the local health departments about where vaccine numbers might be very, very low? How can we get them more information about communities and subpopulations who appear to be at really high risk so that they can focus their efforts and focus their attention on some of those parts of that have fallen way behind other parts of the community in terms of vaccination. So again, let me turn to my guests because they're living on the front end of those efforts to really target our hard work towards vulnerable populations. Dr. Sharrett, since I gave Commissioner Cook last one, would you want to lead us off?
Well, you're exactly right in your observation. In the beginning, back in December, January of 2021, when the vaccine was first available, we were fortunate enough to be able to give the vaccine out into our rural communities. We had vaccine clinics, and I remember the demand was so high for the vaccine. We had to have local law enforcement direct traffic because of traffic issues, people getting in and out of the clinic to get the vaccine. And remember when we had the guidelines where, it was 80 and above, and if you were one day short, and the demand was so high for the vaccine, it was just incredible. And over time, obviously, we've seen that change. But the challenge is not only, and it was an excellent question about the vaccine, is if we can get the vaccine at the point of care where people receive their care, and the easier you can make it for the patient to get the vaccine, the more likely they are to get it. So we're giving it in our offices now. And we've had some challenges with our providers because initially, remember the vaccine, there was so many, especially with the Pfizer vaccine, about transporting it and maintaining it and keeping it. And it really became somewhat daunting for providers. We had providers say, hey, I can't handle that. I don't have a super freezer. I don't have what the equipment that I need to handle the vaccine. Well, there's still those challenges. However, the requirements have changed. It's made it easier as a provider to give the vaccine. We have the vaccine in our clinics now, available in at our rural health clinic here in Jamestown, Ohio. We have it. And the best time we have found to vaccinate somebody is right at the time of their visit. We talk to them, they ask us a question about the vaccines, and we answer the questions. And if they make that decision at that moment, it is so much more effective to have the vaccine right here and give it to them at that time. So those overcoming those things and having it available, and we're seeing that, I think has really made a big difference, especially in our rural communities. Now we have a lot of work to do, and certainly we're not where we need to be, but we are making progress, and we'll continue to try to do so. So not only at the individuals in receiving the vaccine, but our individuals who are giving the vaccine and handling the vaccine, the easier we can make it for them and still maintain the integrity of the vaccine, the more success we're going to have in getting people vaccinated.
I think Dr. Sharrett said it right. Here in Clark County, the thing that comes to mind is what I mentioned about partnering with maybe some partners you don't typically think of, the grocery store. So someone coming in to get their weekly groceries, they stop, they see us there, like, you know what, I am due for my booster. I'm going to go ahead and get that. It couldn't be more convenient to get that as you proceed on to do your grocery shopping. But here in Clark County, we have a weekly meeting with a team. And one of the things that we talked about this morning, this is very simple. I simply looked at people and said, let's ask why not instead of why. We're saying, why not go to this place and offer vaccine? Why not go back to a place we've not been to for a few months? When we talk here, everything is on the table for us, and it continues to be. And I think that's just one of the highlights of public health. We're very adaptable, and we ask that question, hey, why not?
Okay, our next question will come from Jonathan Jackson with NBC4 News.
Good morning.
Hi there, Dr. Vanderhoff. My question is basically just asking a bit about how, you guys went from daily cases to weekly cases earlier this month. Do you anticipate, though, that changing sometime in the future? Because we've gotten several messages from people saying, we want to know about those daily rates. Yeah.
Well, I'll tell you, it's very, very hard to predict the future. So I really don't want to attempt to predict where we'll be 6 months from now, a year from now. But what I can say is this. The model which we are currently using, which comes to us from the CDC, is one that was highly validated. In other words, data scientists looked back over time and said, what paradigm would help us to best understand risk at a community level related to COVID-19, given the kind of data that we collect and is available. And the paradigm we are now using, the COVID-19 community levels, really demonstrated itself to be the best one. It really gave the best picture. And it makes a lot of sense. Look, first of all, one thing that we observed from the very start was that while having daily numbers that we would post regarding cases per 100,000 was helpful and was good, it had some shortcomings, because we observed from very early on that the numbers naturally varied depending on what day of the week it was. This makes sense, right? We know from our everyday lives that there are days where we're busier with work-related things and days when we're not so busy with work-related things. So look at the highway. What happens during rush hour on work days? A lot more people on the road. You can go to that exact same time on a weekend, and what do you find? Not nearly as many people on the road. We were finding the same thing with our reports of cases per 100,000. And so what became very, very clear is that actually a week picture was the most accurate picture, because it evened those things out and allowed for better comparison. Also, we really were not making public health decisions, and I think very appropriately, we're not making public health decisions on the basis of 1 or 2 days worth of information. Why? Because we recognize that you need a pattern of activity before you make a recommendation or an assessment. And so what this week does is allow for, first of all, accurate patterns of assessment. Secondly, the measure is now more robust because it also includes not just how much of it are we seeing, which is the cases per 100,000, but how much of an impact is it having in terms of severe illness? How sick is it making people? And one of the most accurate measures we have, sets of measures around hospitalizations. When people end up in the hospital, they're sick. And that those measures, therefore, of hospitalization combined with the level of activity is really proven to be a very good way of determining how much of a burden the virus is posing for us at any time. You know, what would be a wonderful development, not saying it'll happen, but a wonderful development would be at some future COVID-19 were to be maybe still highly transmissible, but just not putting very many people in the hospital. Wow, we'd need to think differently about it then, right? Because it would look a lot like the common cold. And our current measure would help us to see that. Because even though there could be high numbers with very few people ending in the hospital, in that scenario, this current framework might still allow a community to be painted as green or yellow. Looking primarily at cases per 100,000 on a daily basis wouldn't do that for us. So that's my perspective. I don't know if my colleagues have anything to add to that. No.
Okay, our last question today will come from Laura Hancock with Cleveland.com, the Plain Dealer. Good morning.
Hi, Dr. Vanderhoff, this is a question for you and kind of how the state is managing COVID. Basically, Congress declined to add $22.5 billion in funding to a broad government spending bill. And so the government is running out of money for COVID-19 testing, treatment, and vaccines. So I'm just wondering, what position does that put Ohio in? Is Ohio out of money? When is Ohio running out of money? What about people, who don't have health insurance? Can they still get a test? Can they still get a vax? Can you just answer that? Thank you.
Yeah, thank you. It's a really important and very good question. And what it refers to is that at a federal level, there is now, as part of our country's legislative process, there's a process underway right now where the administration and Congress are working through trying to determine ongoing funding related to COVID-19. There are a variety of paths that can be pursued to accomplish that. And my understanding, again, I'm a doctor, I'm not a legislative expert, but my understanding is that one of the paths related to a piece of proposed legislation that has met with some pushback, met with some challenges. But my understanding is that the process is not at a standstill, but there are other efforts underway to look at, all right, how will we accomplish this very important work? At the moment, what I would say to people is, rest assured, if you need to get a test, if you need to get a therapeutic, if you need care, you can get that. Please go get your vaccine. Please, if you need a test, get a test. And know that there are very, very many people, including at the state level, at our local health district levels, many, many people who are working actively behind the scenes to inform and participate in this dynamic process that's part of being an American.
We want to thank all of our guests today. Dr. Vanderhoff, do you have any closing remarks?
Again, I want to thank my guests. I'm so grateful for them stepping away from their very, very busy lives to offer their expertise and their insight. Also want to thank the press for your continued attention to this very, very important ongoing health issue for our state. Thank you all.
This concludes today's